Hi everyone, how are you? Welcome to another question and answer session. This is the physiology portion of MRCS exam. Here, this is the question: which of the following drug is least likely to cause syndrome of inappropriate antidiuretic hormone release? That means SIADH. That means what is the following drug is not responsible for SIADH? That means the syndrome of inappropriate ADH secretion. Here the options are haloperidol, carbimazole, amitriptyline, cyclophosphamide, and 5-fluorouracil. So we have to find out one of the drug which is not responsible for SIADH or syndrome of inappropriate ADH secretion. So first of all, let's see the normal action, or let's see development of the SIADH. So first of all, here we can see this is the posterior pituitary. Here we can see this is the posterior pituitary. Actually this portion is the posterior pituitary, this portion is the posterior pituitary, and here is the anterior pituitary. And posterior pituitary, there is two important hormone. One of them is the ADH or vasopressin. So ADH or vasopressin is released from the posterior pituitary. They then come to the kidney, acts on the distal convoluted tubule and collecting tubule and collecting duct, mainly on collecting tubule and collecting duct, and it causes reabsorption of more water, and it reduce urine formation, and it increases the water content in our body. It is the normal phenomenon of the ADH. But sometimes some chemical agent, some drug or some hormone may act like ADH, and they act on the collecting tubule, collecting duct of the kidney, and they increase more water in our body, and in this condition is known as SIADH. That means syndrome of inappropriate ADH secretion. So we have to find out the chemical agent or hormone which is responsible for such type of action. That means which can act like ADH. So let's see the chemical agent or hormone. So first of all, here another figure showing the same event more accurately or more obviously. Here we can see this portion is the posterior pituitary, and this is the anterior pituitary. And posterior pituitary ADH release, it acts on kidney, and it causes reabsorption of more water in the blood, and increases water content in the blood, and decrease osmolarity of the blood. Now here you can see the different type of drug which causes SIADH. That means the syndrome of inappropriate ADH secretion. Here one of the mnemonics, here we can see this is the ABCD. By this mnemonic we can remember the name of the drug. So first of all, A for analgesic. That means analgesic, some important analgesics such as the opioid analgesics and NSAID, and these drugs are commonly used to reduce the pain. Then B for barbiturate, another important drug acting as a sedative and hypnotic, and C for cyclophosphamide, chlorpromazine, carbamazepine, and D for diuretics like thiazide. So these drugs may act as a ADH and responsible for resulting SIADH. This is the another box, and here we can see the SIADH. Here you can see this SIADH, responsible for SIADH, different option. First of all, here you can see another option which is the malignancy such as the small cell cancer of the lungs. So small cell cancer of the lungs, they may cause the SIADH. Then also from the pancreas and prostate. So the lung cancer, small cell cancer of the lung, cancer of the pancreas, cancer of the prostate, they may cause SIADH, which is the syndrome of inappropriate ADH secretion. Because from the different type of cancer, chemical substances are released, and these chemical substances is acts on the kidney tubule and causes more water reabsorption, and it increases the water content in the blood and reduce the viscosity of the blood and reduce the concentration of the blood. And some neurological feature may also responsible for the development of the SIADH, such as the stroke, subarachnoid hemorrhage, subdural hemorrhage, meningitis, encephalitis, and abscess. So in this condition, we also find the edema of the patient, because when more water content, so there is concentration of the sodium reduce, and for this condition water leaked from the blood and it enters into the interstitial spaces and they causes edema. So in case of the stroke, subarachnoid hemorrhage, subdural hemorrhage, meningitis, encephalitis, or brain abscess, it is typically found the edema which is caused by this SIADH. And here some important infection others, such as the tuberculosis, pneumonia, and drugs sulfonyl urease, SSRI, tricyclines, carbamazepine, vincristine, cyclophosphamide. So these are another important drug responsible for development of the SIADH. Some other causes, such as positive end expiratory pressure and porphyrias, so they are also responsible for the development of the SIADH. So here finally we can see the options. Which is the 5-fluorouracil, and 5-fluorouracil, it is not responsible for development of SIADH. Other options, such as the haloperidol, they are responsible for SIADH. Carbamazepine, also responsible for SIADH. Amitriptyline, cyclophosphamide, they are also responsible for SIADH. So only answer is the 5-fluorouracil. So the 5-fluorouracil, it is not responsible for development of the syndrome of inappropriate ADH secretion or SIADH.